Hi, this is Scott Miller. Welcome to my top performance blog. I have the pleasure of speaking to Dr. Daryl Chow, a psychologist in Australia, and also the person that I'll be teaching the upcoming Deliberate Practice Intensive in Chicago this August with. Hi, Daryl.
Hello, Scott, from the other side of the world.
You are on the other side of the world, and I'm heading there tomorrow, actually, going to be in Melbourne. So,
That's
but
great.
but you're on the other side of the country.
Of the country too, yeah, in Western Australia.
So even though we'll be closer, we'll still be far apart.
Well, this is the time of the day that we usually speak as well, right? Your morning, my night.
That's exactly right. And I wanted to speak to you with you today, Daryl, about something specific you've been doing, and that's a project called the Difficult Conversations Project. Can you tell us a little bit about that?
Yeah, so you know this, Scott. We've been working at this together, you and I, with Sharon and Jeffrey in Singapore, and we, the difficult conversations in therapy, or DCT, has been something we've been working on for, I think, close to 3-4 years now. And we started off by running a pilot, and now we're in the midst of completing the final randomized trial round. But briefly, the Difficult Conversations in Therapy project is based on the question of whether people can learn in a controlled environment with repetition, and more importantly, with challenging scenarios that are realistically linked to clinical practice. So they are presented with simulations of particular challenges, and they'll be given feedback through that process.
And so give us an example of one of those difficult or challenging conversations.
Sure. I think one of the early days scenario that we were using was of a client that was angry. More importantly, it's not just a client that's generally angry, but somebody who's angry at you.
And that's not necessarily something all of us are good at?
Much to my naive surprise, we face real big challenges with that. How do you deal with the heat in the moment? How do you respond therapeutically without giving sort of platitude sort of response?
Mm.
Is very confronting and challenging, and lots of things that we can glean from that.
And in the initial trial, where therapists were exposed to a video with somebody who was angry with them and had to reply, what was the
Yeah.
good news about this trial?
What's the good news? Well, let me first say the news that wasn't so good. Uh,
Okay.
so I think in the pilot, what we found out was that left to therapists to reflect alone in an environment of reflective practice, they didn't get any better.
So
So,
just
so
left on your own to think about your response and try to improve, no
yeah,
improvement.
no, no
Something
improvement
more
in
was
that.
required.
Something more was required, which I think when we were doing the repetition, we started to we allowed them to reflect on their own, but then after that, we gave them feedback. And when you gave them feedback, it sort of disturbed the system in their minds a little bit, jolted them out a little bit, and some people started to apply it immediately to improve their response. Some people took a few more rounds to be able to find their own voice in that response. So
And finding their own voice was a critical part and is a critical part of both the
yeah.
first and the second trials. Can you say something about why that's important and how you are facilitating that in this particular study?
Yeah, so we didn't want people to get stock responses like we tell them this is how you should respond to the question. That's exactly what we don't want to do.
Mm.
Instead, we want to give them guiding principles that they can glean from and then apply that to their own style, own voicing, own approach of the way they were doing it. So, for instance, one of the things that we will prompt people is to get them to think about what is the explicit emotion that you like to be able to identify before going to the implicit emotion.
Mm.
So, for example, when we were talking about the angry situation, people would try to go deeper before explicating what's the thing that's in front of them,
Right.
which is anger, right?
Mm.
At
Mm-hmm.
whom? At you.
Mm-hmm.
So to help them in that sort of fashion, but to say that in their own ways, because we are not trying to teach people methods, we're trying to teach people principles,
Right.
principles before the methods.
And so if that's sort of the bad news, and then we've talked about how you managed to give the feedback, what was the
Yeah.
good news over the time in the trial that's already
Oh, did
taken
I forget the
place?
good news? So the good news, as we've seen from the pilot, and now we're just trying to pull together the results as we speak, actually, for the clinical trial, is that individuals seem to benefit within this sort of controlled environment with successive refinement in an environment that's focused with some feedback. It's sort of like, that old Bruce Lee saying that I don't fear the person who has practiced 10,000 kicks once. I fear the person who practiced one kick 10,000 times.
Right. Right.
So, you see people refine and they refine and they try to get to the point where they can apply those principles to their own voice. But to me, what's most interesting is to see after the trial when we sort of reached out and kind of just hear how are people thinking about this. And here's the thing that we get a response so far is they say they can't stop thinking they can't stop thinking about the cue cards, the feedback that we've been giving, because they'll be thinking like, oh, this is the moment that I should be thinking about this. This is the moment I should think about that.
Uh-huh.
Sort of how they would chunk, and they're sort of pulling from that. And that's really edifying to hear.
Perfect. So this has had not only an impact in the moment, therapists gradually improve, but it also seems to stimulate a different thought process that continues beyond the boundaries of the formal study.
From the people we heard back, yes.
Perfect. Daryl, what was the most sort of surprising thing that stood out to you from the past trial or the current trial, if anything?
Yeah. I think there were two. The first one is sort of a side note, but I think is important. I think there was two people that really benefited the most in this trial.
Hmm.
Um, that was Sharon Liu and myself,
Aha. Interesting.
because as we're going about it, we are the ones who've been looking at the responses, trying to graft best responses and see why is this so impactful compared to the others. So in the role of just observing and trying to understand how people respond, I think we both benefited the most.
Wow.
Um, yeah, that's one. The second thing is when we get people to respond, so each person responds about 8 times,
Hmm.
right, through different scenarios. We also ask them to rate how well they responded
Mm-hmm.
and how difficult they felt that scenario was.
Hmm.
So every time they were asked 0 to 10 how well they responded and then how difficult that was.
Hmm.
This is anecdotal. We have not crunched the numbers, but what's really surprising was that the difficulty started to increase
Mm-hmm.
and how well they responded start to decrease.
Okay.
Does that make sense?
Absolutely. So it sounds as though exposure to ongoing feedback about one's work, even though it's in this kind of controlled environment of a randomized trial,
Yeah.
attacks the very thing that might limit effectiveness, which is false confidence,
Oh yeah.
and breeds what Helen Neeson Lee would say is a more humility. Is that what you're saying?
Well, yes. I think it creates what Nissan Lee was talking about, this humility and professional self-doubt thing. I think we shook people's sense of confidence quite a bit, and it's confronting. Feedback can be confronting as much as it's couched in a good way.
Right.
But post hoc, as we kind of look back, I stumbled upon this scientific explanation, which it's so beautifully put. It's just called the illusion of explanatory depth.
Hmm.
Illusion of explanatory depth.
Hmm.
The theory is if you ask a person how well do they know a fridge works, a toilet flush works, they rate a certain way. But then you get them to explain it and deconstruct it point by point and write it down. and then ask them again, how well do you know how the fridge works or how the toilet flush works? It starts to
Mm.
drop. And I
Wow.
think it's in some way for us when we break down just a small tiny segment, right? And then we just expose them to that again and again and again. It just makes them sort of like, shit, I don't really know what I thought I knew.
Right. And this actually results, if we tie the results from the present trial to the past one, in
Yeah.
improved empathic responding, even though people have had their confidence shaken. Am I right about that?
Yes.
Interesting.
Uh, yes. That's why it's surprising for me. It's like there's a whole amount of ground that's been shaken, but then they've responded in a way that's more impactful, more therapeutic, more empathic. But then I I don't know if this is still, because we get them to reflect, right? To think
Mm,
aloud, and they go, I don't know if this sounds like me. I don't know if this really works.
mm.
But from our objective standpoint, when we look at it, it's pretty impressive. So, but Scott, here's my thinking around it. Can I add?
Yeah,
I don't think you know, as much as this is about training empathy, I don't think you can train someone to be more empathic,
right,
but I think you can train them the processes that leads to empathic responses.
right.
I think in some way we sort of flow through, we're able to use that kind of controlled environment to help people to lead and to learn from that kind of process.
Right. Humility, professional self-doubt, even empathic responding
Mm.
is not a place you get to, but rather a process. And if you're engaged in that process constantly, people's experience of you as an empathic, warm, genuine person improve.
That's right.
Hey, Daryl, thanks so much for speaking with me today. I know there's going to be a lot more coming about the DCT shortly as you all finish up all of the massive amount of legwork you're doing. Look forward to seeing you. I think next week. Is that correct?
Next week we will
Yeah.
be at Sweden for the AIDS conference. By then maybe I might get a bit more numbers, but I'm gonna be talking a little bit about the system of practice before deliberate practice, and it ties in with what you and I are learning from a project like this in the DCT.
Perfect, Daryl. Thanks so much.
Thanks. Good night.